Namaskar. Thank you, Sauji. My warm greetings to all friends who are connected with this program. At the outset, I would like to express my sincere thanks to esteemed Professor Vijayanath Mishra ji and his team, Dr. Abhishek Pathak ji and Dr. Varun Singh ji of Neurology Department of Banaras Hindu University for kindly accepting our invitation to share their experience under the flagship initiative of the Indian Embassy India-Ireland Friendship Lecture Series. This is a new initiative of the embassy to mark the 75 years of India's independence, Azadi Ka Amrit Mahotsav. Also, this is 100 years of Ireland's independence. So we are in the embassy looking for innovative ways of strengthening and broadening India-Ireland connectivity and friendship for mutually beneficial partnerships and cooperation. And while we are looking at business opportunities, we are looking at government to government, broader partnership. I'm also keen to promote genuine people to people learning and sharing and working together, benefiting from each other's innovations in social transformation. And in that context, today's event is very unique and very special for me. On the theme of Corona, we have had a lot of interactive events in India and also other countries because sharing of practices, best practices, and sharing of experiences in dealing with, coping with Corona has been very important part of the global diplomatic initiative. Corona in many ways is truly unprecedented crisis for the entire world. First of all, if you look at the spread, the coverage of this pandemic, it has been truly global. Even compared to the Second World War and First World War, which were relatively limited in their geographical impact, this is a truly global, pervasive tragedy affecting all countries, rich or poor, and even within the countries, it has affected every part of each country, whether rich, poor, irrespective of social strata. So it has been a truly global, universal challenge for everyone. Secondly, it has not been just a healthcare challenge. It has been a testing time for human life in society, economics, trade, national and international engagements. And it has tested the resilience and strength of government institutions, public institutions. It has challenged everything. The normal way of thinking and doing business, normal way of life has been disrupted, and it has provoked all of us to think afresh about how do we deal with contingencies that might appear in the future. And even from the perspective of Corona, even from the global perspective, India's challenge in dealing with Corona pandemic has been truly exceptional, truly unique. We have had such a complex challenge before the nation because it had taken all of us by surprise. It was a scenario, it was like the way virus was evolving. Nobody in the world was clear about the origin. Nobody was clear about the trajectory, how it is going to evolve. So we were all dealing with huge uncertainty about how to deal with this, what will be effective, what will be not effective, what precautions to take. So everything was so fluid. And look at the complexity of India as a nation. We had to deal not only with the healthcare dimension of the Corona pandemic, but also a lot more complex human challenges. For example, we had to provide for very basic healthcare needs to deal with the Corona pandemic in terms of PPE and test kits and basic medicines to deal with this. They had to be ramped up very drastically. But also the issue of labor migration. We had to deal with about 6 to 7 million people within India moving from one part of India to other part of India at a time when there were huge uncertainties about lockdown and what kind of precautions and what kind of isolation measures to be put in place. Also, in the global level, we have had to deal with very large scale, unprecedented scale of repatriation from other countries. And under Vande Bharat mission, we have had to deal with about 18, 19 million international passengers their travel to be facilitated. Also, for such a large, diverse, socio-economically like complex society like India, it truly required a dynamic, charismatic, visionary, popular leader like Modi ji to unite the whole country behind one single national common cause of combating corona. And the whole nation, whether it's a public sector, it's a government sector, all ministries, all state governments, on that particular issue, everyone worked with coordination and with same purpose and determination. And not only the country rose to the challenge, we ramped up our manufacturing facilities in a very remarkable manner, not only to take care of our own domestic needs, but also supplying vaccines and medicines and PPEs and test kits to a very large number of countries. Vaccine production was boosted within the country, and we have implemented world's largest vaccination drive. Close to 2 billion doses of corona vaccine have been administered. That would not have been possible without a collective concerted effort. Also, on the international solidarity front, India has been supplying test case, medical consultancies, and all kinds of assistance which we could provide to our friendly developing countries. That has been very much appreciated. So on one hand, the role of the government of India machinery and the state agencies, their role has been properly like disseminated, and there is a greater awareness. But the role, equally important role of the non-governmental sectors, role of NGOs, and the role of civil society leaders, role of grassroots level thought leaders, social pioneers, that also to me is equally important. And that is why when I heard about the very inspiring leadership shown by Professor Mishra ji and his team, Dr. Abhishek Pathak ji and Varun Singh ji, it really captured my imagination, and I felt so overwhelmed by their spirit of giving back to the society. In the times of extreme complexity and extreme uncertainty, everything was in flux. Their positive spirited effort served as a source of, as a beacon of hope and reassurance and strength to the local society. And I got myself so much like encouraging feedback that their efforts were shown as like giving a new lease of life to a lot of people who were feeling very hopeless and helpless. Also, this is a true example of self-driven. In Sanskrit, there is a saying, Atmaiva Atmano Bandhu Atmaiva Ripura Atmanaha. The best help that can be provided is to strengthen your own self. And the leadership, the vision that Dr. Mishra and his team displayed in bringing community together, showing the solidarity and reaching out to the most vulnerable sections of the Indian society, that needs to be studied better, that needs to be appreciated and acknowledged better. Our Prime Minister has given us a motto as a country, Sabka Saath, Sabka Vikas, Sabka Prayas, Sabka Vishwas. We all 1.38 billion people have to work together, whether in government or outside government, with same determination that no one should be left behind. And whatever we do must keep the last man standing in the thought process. There has to be a similar effort to reach out to the most vulnerable sections of the society, not only from the government side, but also from all Indians. And your example, Professor Mishra, has been an example, a shining model of self-help and vocal for local. How do you leverage very modest, very limited resources which are available locally to provide maximum impact, maximum support to the people who need it most? We have been a pioneer in frugal innovation, innovation which is not only relevant for the developing countries' needs, but also they are affordable, affordability. And your model of ICU on the road and providing healthcare consultancy and support to the people where they are, where they need the most. This is a very unique model of frugal innovation and service delivery. I think today's lecture will educate all of us about your initiative, your pioneering role in a heartwarming social outreach and social support. And I do hope that the presentation you will make will give us new ideas to identify opportunities between India and Ireland, how we can use your experience, how we can use the experience of similar minded NGOs and civil society organizations in Ireland to create a real people to people warm friendship. Once again, my very sincere gratitude to you, Professor Mishra ji, and your dynamic colleagues, Dr. Abhishek Pathak ji and Dr. Varun Singh ji. I look forward to listening your presentation with great interest, and we will have a lot of follow-up work to do. Thank you so much.